Hi, Consumers for Affordable Healthcare is recording this webinar for you today in February, middle February of 2021. We're going to be doing a special edition of our Understanding Your Health Insurance Options webinar. And it's a special edition because we're going to be talking about your options in light of the new special enrollment period that we are within right now. Consumers for Affordable Healthcare is a small nonprofit that's been around about 33 years, whose mission is to advocate the right to quality, affordable healthcare for every person in Maine. We operate a helpline where we can talk with you about all kinds of coverage questions, including why you might need insurance. If you are uninsured right now and have thought so far that maybe you don't really need it, consider these things. Consider the costs of these possible things. I always think about the guy who called our helpline years ago who went out to his shed and turned on the heater and it blew up. He happened to be uninsured just for 1 month because he was in between jobs, but it was very bad timing. We just don't know what will happen, and these costs are very high. So if you can get insurance, it's a great thing. Here's what we're going to be talking about today: Marketplace insurance, MaineCare basics, COBRA, and a few other things. Here's a highlight of the major topics that we'll look at today. The Marketplace. This is a place where people can get private health plans with federal subsidies through the Affordable Care Act. Nearly 9 out of 10 Mainers who have these plans can get subsidies to lower the cost of their plans. We'll also be talking about MaineCare, which is a comprehensive, low cost or free for most people health insurance for Mainers who meet certain requirements, mostly household size and income. And then we'll also be talking about COBRA. This is an acronym. We'll talk a little bit more about it further down, but many Americans get their health insurance through their job. And if they leave that job for whatever reason, some of those people have the right to continue their coverage through the law called COBRA. So we'll be talking about this some more as well. So first, let's talk about the Marketplace. Marketplace is a website. Here it is, healthcare.gov. This is a website where you may be able to buy a private health insurance plan and apply for subsidies to lower the cost of that plan if you are eligible. People can shop for a Marketplace plan if they don't have coverage offered by an employer or a spouse's employer, and also if they cannot get MaineCare or Medicare. I think of the Marketplace as an online farmer's market for insurance. There are multiple companies there selling multiple plans. And again, there are subsidies for all those people who are eligible. Give our helpline a call if you would like to find out more about any of these things. Right now, we are in something called the COVID-19 Public Health Emergency Special Enrollment Period. Due to the pandemic, there is a special open enrollment from February 15th until May 15th of 2021. Here's our helpline number. Give us a call. We'd love to help you figure out what you might be eligible for and what might be a good decision for you. During this special enrollment period, anyone who's eligible for Marketplace coverage can sign up. If you already have a 2021 Marketplace plan, you can even switch plans during this time. If you have a COBRA plan, you can drop it early and sign up for a Marketplace plan if you decide you'd rather do that. If you do change plans and have already paid toward your 2021 deductible, it may or may not carry over to a new plan. If you call our helpline, we can help you figure out whether how that would apply to you. So here is information about the Marketplace subsidies. There are 2 different kinds of help. One of them is called advanced premium tax credits. This is for a large swath of the population. It's available to people who are under 400% of the federal poverty level. If you look over here, you can see how those numbers play out for different household sizes. These advanced premium tax credits, or APTCs, I think of them sort of like an allowance. Based on your income, the government gives you an allowance, and you can spend that towards any of the 32 to 35 plans that are on the marketplace. The second kind of help is called, on the website, it's called extra help. And in the law, it's called cost sharing reductions, or CSRs. You can see a smaller group of people is eligible for these kinds of assistance because it's only given to a lower level income person. In addition, you do have to buy a silver plan to get the second kind of help. We're going to talk about a silver plan in just a moment. But again, the first type of help, advanced premium tax credits, those are subsidies that the government will send for you like an allowance, but to whichever plan you select. The second type of help, extra help or cost sharing reduction, is available if you purchase a silver plan and if your income is in a somewhat lower range. And what it does is lower all your out-of-pocket costs, like your deductibles, also your co-insurances, your co-pays, and even your out-of-pocket maximum is one of my favorite parts of the Affordable Care Act. So here we can talk about bronze, silver, and gold plans. It's kind of like the Olympics. Bronze plans have the lowest monthly premiums, but the highest deductibles and cost sharing. So it's sort of like a bargain basement plan. If you're really healthy, might be a good plan because it does cover certain preventive services at no cost at all. And the premiums are usually relatively low. Let's skip down to the gold plans now because they're the opposite of the bronze plans. I talk about them sort of like they're the Cadillacs. They have the highest monthly premiums, but if you need care, you would have the lowest deductible and the lowest of all the other kinds of cost sharing as well, like the co-insurances, the co-pays, and the silver plans are in the middle. So the silver plans have a moderately sized deductible and other cost sharing, unless you are eligible for the cost sharing reductions, in which case all your cost sharing would be lessened through that mechanism. And there's a super easy way that you can see what all these plans look like and how much they would cost for you by going to that website I mentioned earlier, healthcare.gov, putting a slash, and then the two words C hyphen plans. Put a hyphen in between the two words, and C is the verb, not the letter. So if you go there and you can already project, you've already done the math for what you think your income might be in this year of 2021, then it will only take you 30 seconds to see all the plans and how much they would cost you, and really pretty much to get any kind of detail you might ever want about them. So because we're looking at 2021, everybody knows that income's been kind of weird last year and even still this year for a lot of people. So we came up with this concept called the buckets, because in order to get the right amount of tax credit for 2021, you do need to project what you think your income will be for the year of 2021, which can be crazy difficult right now. We understand that. So bucket one would be income that you got from a job starting January 1st until you got laid off, if that happened. Bucket two would be your weekly base unemployment amount multiplied by the number of weeks you collected it. And then bucket three is the extra $300 a month multiplied by the number of weeks you got that. Last of all, bucket four would be any other projected earnings that you think or hope or plan to earn during the year of 2021. That could also include if you're taking money out of a tax deferred IRA where you'll be paying taxes on it when you take it out. All of these four buckets, or any of them that apply to you, do then need to be added up, and that can give you your estimated 2021 income. If you are married and filed together with somebody, You might have to do this, all these buckets or some of them for both partners in the marriage. Again, give our helpline a call. We know this is really difficult and it's tedious, but we have a lot of practice, so we'd be happy to help you through this. Give us a call at 1-800-965-7476. So this chart talks about what income counts. And down in the first column, this wider column, you can see different types of income are listed here. Not every single one, because it doesn't list IRAs, for example, or Social Security, but most of them are listed here. And then the second column says, does it count for MaineCare? MaineCare eligibility, we'll be talking about that in a minute, but is primarily, not always, but mostly based on current monthly income. And then the last column says, does it count for the marketplace? Here's where one of the ways MaineCare and the marketplace are different, because the marketplace eligibility for tax credits and cost sharing reduction is based on projected annual income, not current monthly income at all. So they're quite different that way. So the first type of income that's listed here is the tax rebates. These are the things that maybe they were called stimulus checks. There was at least one, maybe two people have gotten $600. These are not countable income for either MaineCare or the marketplace. So you can see the no and the no. Then going down to the next row, unemployment insurance. This lists the base unemployment benefits, which are calculated on your prior earnings. These are counted for MaineCare, yes, but only in the month that you get them. And they're also counted, you have to put them into your bucket if you're trying to figure out your income for the marketplace. But then look down below, underneath your base unemployment benefits, we have the temporary extra $300 that people are getting right now. It's in February. So we understand that this is going to go until the middle, just about the middle of March. And we don't know what will happen after that, because it will depend on what Congress does. So the temporary extra $300 does not count for MaineCare. That was decided by Congress. However, it does count for the marketplace. So that would have to go into your buckets, multiplied by the number of weeks that you get it. And then down below here, it has earnings from jobs. So the thing about, for most people, MaineCare counts taxable income. This is not true for everyone, but for many groups of people, it counts only taxable earnings and taxable income. So if you are getting a paycheck, but you have some money that's taken out and it goes into something like retirement, or you help to pay for health coverage, then that income is usually tax deferred, or it's called pre-tax, and it would not count. So you count the rest of the earnings after that part has been removed. However, all taxable earnings for 2021, if you're applying in the marketplace, they all count. For MaineCare, you only count them in the month that you're getting them. So if you had earnings from a previous job, then those wouldn't count for MaineCare. For a current job, yes, they count for both, because MaineCare looks at current monthly income. But then remember, in the bucket system, the last bucket, bucket number 4, was, well, what do you think you're going to make later in the year? And that would count for the marketplace, expected earnings from a future job, but it would not count for MaineCare, because again, for most people, MaineCare is only counting the income that you have when you apply. I will say, though, however, that MaineCare can also be prospective. So if you have a job until today and then tomorrow you have no income, MaineCare can look at your eligibility starting tomorrow, even if you apply today. It's called prospective eligibility. It's really important right now, because a lot of people know they're going to be laid off in a week or two. So they could be applying for MaineCare based on that information. This talks about where do I apply for a marketplace plan. And there's a few different ways, but just to remind you first of all, the public health emergency special enrollment period started last week, and that was on February 15th, and it runs through May 15th this spring of this year, 2021. Once a person applies, you will have 30 days to choose a plan, but take some advice from us. Don't wait 30 days. Just call us and we'll help you if you need help choosing. And then coverage begins on the first day of the month after you have selected the plan. So remember, you can call us and we will help you. If you need help applying, if you don't have a computer or you're not comfortable on them, or it just makes you nervous, or for whatever reason, we will help you. We've been helping people to enroll over Zoom and over the phone. In addition, you can go directly to healthcare.gov and apply if you feel like you have the ability to do that. You feel confident to look through all the plans and figure it out. And then thirdly, there are trained enrollment assisters, which is what we are at CAIC, all around Maine, that provide free help with the application. And if you click here, which is the website for enroll207.com, you will find a list by county of all the assisters, or hopefully, we hope it's all the assisters around the state, who will give you free and confidential help to apply for the marketplace. So we're going to switch over and talk about MaineCare for a couple minutes here. MaineCare Basics, MaineCare 101. You can apply anytime all year. So right now we're making a big deal over the special enrollment period for the marketplace because you cannot apply anytime all year there. But MaineCare is different. You can. Eligibility goes by current income. So you may qualify even if your income was higher before. And then this is important. A lot of people still don't know this, but assets do not count for many groups: children, pregnant women, and anyone between 21 and 64 who is not already eligible for Medicare. No asset test for any of those groups of people. Once you've applied and sent back all the papers that are needed, if you haven't heard back in 45 days, people become eligible for temporary free coverage. So MaineCare and DHHS are doing their absolute best to reply back to everybody before 45 days. However, if after 45 days you haven't heard, really, you should call our helpline and we'll help you figure out what's going on. MaineCare coverage can start back in time, up to 90 days before the application date, if the person was eligible going back that far. This is helpful if you have a bill from any time within the last 3 months and you might have been eligible for MaineCare, then MaineCare could possibly cover that for you. And then lastly here, eligible pregnant women can get instant MaineCare coverage, which is called presumptive eligibility. You can apply for that at any family planning or federally qualified health center around Maine. There are many, and if you want to know where they all are, call our helpline. And then down here below, you can see we have these two websites again. CoverMe.gov is a website that is maintained by MaineCare and DHHS, and it also has a list of all the enrollment assisters around the state. Many of them will also help people apply for MaineCare as well as the marketplace. And CoverMe.gov and Enroll207 both have a lot of user-friendly, easy to understand information about each of these that we're talking about, MaineCare and the marketplace. So we encourage you to check them out. They're nice websites. And they will also link you to where you need to go. So here are some ways to apply for MaineCare. I'm going to go over about 4 of them. Number 1, you can actually apply for MaineCare online through the marketplace, and DHHS has said that they like it when people do this. It's somewhat easier for them. So remember, we've already talked about healthcare.gov. And if you go there to apply and it screens you as eligible for MaineCare, then healthcare.gov will give you a little notice on the screen that says you appeared that you might be eligible for MaineCare. So we're going to send your data to them. So this is a great way to apply for MaineCare. And it's good. I haven't heard really of people's applications getting lost when this happens. So I think that it's pretty safe, but it's really great to follow up with DHHS like a week or two afterwards. So if you might remember, MaineCare primarily looks at current income and Marketplace looks at projected annual income. So it's possible that sometimes if healthcare.gov sends your information to MaineCare, you might need to send a little bit more information to DHHS, and they'll let you know that in a letter. You can also apply for MaineCare directly on the Maine state website at this website here, which is called My Maine Connection. It's the online MaineCare portal. And we have these tips here for you if you decide to apply for MaineCare this way. These are some things that we recommend that you do. And there's one other tip I want to mention that's not listed here because I think it came up after this was put together, but it's very early in the My Maine Connection application. There's a question that says, do you want to receive electronic notices? And you should only say yes to that if you already have a MaineCare number. So like maybe you had MaineCare once in the past and you still remember your number, then you can say yes to getting electronic notices. But if you don't have a MaineCare number, it doesn't work for you to say yes there. You have to say no. Just a weird little complication there. But if you get stuck there, give us a call. And also here's what it looks like right here. And down below, you see the pencil and the paper clip here. And down below them on the homepage of My Maine Connection are some important things. There are some bullets there. One of them has a link to a help desk if you get stuck. There's also a little PDF ebook that you can look through in case you need any help with the application. And it will go over that little thing that I just mentioned about saying no if you don't have an ID number already to the question about electronic notices. And then there's even a little video there now as well that will take you through the application. There's a few other ways to apply for MaineCare. One is you can call us. Yay, give our helpline a call. And if you need any information about any of the stuff in this little video, we'll be happy to talk you through that on the helpline. You can also call DHHS. Sometimes they're hard to get through to. They half their call center staff got taken over by the CDC, and so DHHS is working really hard to try to do the best they can to answer your calls quickly. But if you can't get through to them, just call us. You can mail in applications to this address right here. No matter where you live in Maine, all applications go to Farmington. That's where their central scanning center is. And then if you have an internet and a printer with ink in it, you can also print applications off from this link right here. You can mail your applications in. You can email them. We always suggest that you email them with a red receipt, but I understand that not every kind of email allows red receipts anymore, which is unfortunate. You can also fax them in as well. And then if you have a chance, you can call to check up on those applications. I like to recommend to people if you're going to mail an application, to mail it by certified mail. I know it costs extra money, and DHHS has said to me that doesn't prove what was in the envelope. And I understand that that's true, but I just have a belief that if you mail it by certified mail, it's less likely to get lost both in the mail and when it gets to DHHS. And then lastly, the last way that you might want to apply for MaineCare is at your local office. Every county has an office. However, and they're all listed at this web address right here, or you can call us and we will tell you the one that's closest to you and the hours. And of course, you would bring things with you like income and ID documents. However, because of the state of things right now during the health emergency, I would say before you go to any office in person, that you should call first to make sure it's open. So here's some MaineCare guidelines for 2021. These are based on the federal poverty levels, which change very slightly at the beginning of every year. You can see going across the top of this chart, we have different categories of MaineCare. This is not all the categories, but these are the ones we deal with the most. And then down the left side over here, household size, it tells you, you can see that based on your household size, the numbers of eligibility caps changes. So we are here for you to help you understand all this stuff. Love to hear from you. MaineCare income, here are some ways to think about it. Pretty much by law, they look at point-in-time income, which means current monthly income. But there are some cases where they do use annual income. If a person is self-employed, they will ask for your last batch of tax return, for your most recent tax return. But another way that annual income can be looked at is if you have varying income. And for varying income, sometimes depending on the time of year, also year-to-date numbers will work as well. There are things in the rules that allow for income to be looked at in the most fair way. So if you have self-employment income or varying or seasonal income, we are happy to explain the rules to you. You just give our helpline a call. And that number, it seems like it's on the bottom of every slide. Look at that, 1-800-965-7476. So here's a question that we get sometimes. What if I just became self-employed and have no tax returns yet? Well, that's happening to a lot of people right now. That's okay. You just need to show the income and related costs in some way. If you use Quicken or something like that, is there something else besides Quicken? I'd like to know what its competitor is, but if you use something like Quicken, that's awesome. You can print out a report. It will show the money that you've brought in, but also all the costs that you've had to spend your money on. But if you don't have anything like that, then just a written report with columns on a piece of paper is what they will have to take. If that's what you got, then that's good enough. But you do have to have numbers on paper at least. So sometimes people are denied MaineCare. If you get a notice saying that you are losing coverage and you have free MaineCare and you think that it's a wrong decision, and you request a hearing within 15 days, then the coverage will continue until the hearing. But regardless of whether you have free MaineCare or some other kind of MaineCare, it's best if you can appeal within 30 days from the date of the denial. It's not the end of the world if you don't, but it's easier. I think if you don't, then you have to reapply. But also, if I mentioned the 45-day rule earlier, if you have applied and it's been more than 45 days since you have applied and you haven't heard back, you can appeal that. In that case, you're appealing a lack of a decision. But we might be able to help you with that as well. So here's the COBRA and the words that the letters stand for. They stand for a law, the Consolidated Omnibus Reconciliation Act. So COBRA is a way to keep getting the same insurance you had through your former employer when you leave a job for whatever reason. If you had the insurance while you were there, then you can keep getting it after you leave, as long as your employer had 20 or more employees. They must by law offer COBRA. So the employer actually has 60 days to send you something called an election notice. And then when you get it, you have 60 days to sign up. So you can put that off sometimes. Call us and we can talk you through this. But most people don't take COBRA because of the cost. You're paying the part that your employer used to pay for you, plus the part you used to pay for you, plus a 2% paperwork fee. And most people are not aware of how much their employer is paying for them. They just know how much they're paying. And when they find out the full cost of the COBRA, many people are like, well, I can't afford that, reasonably enough. So it's always worth comparing Marketplace plans with the COBRA before signing up for COBRA, because you might be eligible for a good plan on the Marketplace with a subsidy. And so please call our helpline so that we can help you figure all this stuff out. Here are a few important things that we wanted to flag for you, calling them red flags. One of them is something that I can't tell you how many people have done this. They just go to the internet and in the search box, they put the word insurance and then they put their number there. And then within an hour, they've gotten 30 calls from brokers all around the country. And we've got some stories from people who have called our helpline who bought plans from brokers, and I sort of hate to single out specific states, but because it's probably not really relevant, but you don't buy a plan from a broker in another state. It's really better to get a plan through someone who is certified and registered both at Maine's Bureau of Insurance and at healthcare.gov. And that's going to help ensure that you actually get a decent plan, which the calls that we've had from people who bought brokers from other places were about having gotten plans that were pretty worthless. It's very sad when that happens. So then lastly here, be aware of plans that are not qualified health plans. So the Affordable Care Act created a bunch of things that are required for a plan to cover and do in order to be called a qualified health plan. And not all things that might call themselves or pretend to be insurance will meet these qualifications. There's something called the health sharing ministry, which oftentimes might look like insurance, but actually is not. And if you buy something from one of these, you actually have no rights at all if something goes wrong, because it's not actually insurance. So it's not going to be covered or regulated. It's not regulated by anyone. So down here at the bottom, it says explore all your options. Marketplace, MaineCare, COBRA, how can you figure it out? It's very confusing. We will help you if you just give our helpline a call. Our helpline is free and confidential. We will help you figure it out. Here's a few more red flags. I like to say that you should make a file. If you end up with a Marketplace plan or a MaineCare plan, you should create a file, and all the mail that you get, you should actually open it and then read it and save it in that folder. It's so helpful if you can do that. Which if you start an account either at healthcare.gov or even at My Maine Connection, you definitely want to write down your name and your username and password. And like I said, I ask people to save it in 2 places. If you're applying on the Marketplace, you're going to get something called an eligibility notice. This thing is a PDF that shows up in the bottom left of your screen as a tab. This is a legal document for you. It's super important that you look for it, open it, read it, and save it. Again, I ask people to save it in 2 places. The eligibility notice that shows up at the bottom left of your screen as a tab has how much tax credit you'd be eligible for, how much cost share reduction, if any, that you would be eligible for. And it will also tell you if you have further steps that you need to take. So it's super, super important. Sometimes it's going to say, it looks like you're eligible based on what you've told us for this following amount of assistance, but we also are going to need some other information from you within the next 60 days. So you want to be sure to read that eligibility notice and pay attention to it. When your income changes, you need to update that, regardless of whether you are at having a Marketplace plan or MaineCare. MaineCare asks you to update information in income and household size within 10 days. But also it's important to update this information from the Marketplace as well, because if your household size goes down or your income goes up, then it could mean that you're getting more tax credit than you're now suddenly actually eligible for. And we want you to be able to fix that so that doesn't go on. We don't want you to owe any extra tax credits back next tax time. So it's important to update your household size and income if they change. The last few slides are resource slides. Here, if you go to our website, www.mainecahc.org, you will see that we have a COVID page there with resources regarding COVID-19. Here are some other resources that we often recommend. First of all, of course, us ourselves, our helpline. There's our number again, and we have a helpline email as well. Then we've listed for you again the coverme.gov website, which is being maintained by DHHS and has great info on it, and also the places you can get help applying, as well as Enroll 207, same thing. Underneath, help with Medicare coverage. The area agencies on aging receive funding in Maine for helping people with Medicare questions. So if you think you're eligible for Medicare, you should find your area agency on aging that's near you. There are 5 locations around the state, and if you need help with that, we will help you. Legal services for the elderly, they're another set of buddies of ours, and we do refer some people there that have tricky Medicare questions and problems. Then underneath, Maine Equal Justice, that is another nonprofit. They are a group that we work with very closely on many different things. And lastly here, Pine Tree Legal, which is free legal help for people who are income qualified. And then this, I believe, is the last slide. These are a number of other kinds of help. Some of these will take you to flyers on our website. We have a library of flyers on different topics, including hospital free care, sliding scale programs, health centers, prescription assistance help, all kinds of things like that. So we'd love for you to call us, and we'd also love for you to visit our website. So here's the very last little bunch of links, and then a thank you. Thank you very much for listening. If you listened all the way through, you did a great job. And hopefully you wrote down all your questions, and now you're going to give us a call on the helpline. And if you do that, tell us where you got our number, okay? So we look forward to hearing back from you. Thank you very much.